Hi, sorry, do I say hi everyone or? My name is Boitumelo Vavani. My PhD research was on living positive with HIV, focusing specifically on self-help interventions among people living with HIV in Botswana. I focused on depressive symptoms among people living with HIV because depression is quite common among people living with HIV. It's also important for us to research depression because depression does affect how people feel, how people think, and also with HIV specifically, how people adhere to medication, which can then interfere with quality of life. So a lot of the times, particularly in low and middle income countries, people don't have access to treatment for depressive symptoms. So it was important to try and see what treatment options are available that we can adapt or scale up so that they can reach as many people as possible in places where there's very little access to mental health care. So we conducted 5 studies that were interrelated. We did a systematic review to see what already exists in the literature about self-help interventions that could help treat depressive symptoms. And then we also did a baseline study to see whether depression was a problem for people living with HIV in Botswana and what their mental health needs were. And also we did a feasibility assessment. And then following that, we adopted a self-help intervention for people living with HIV in Botswana to treat depressive symptoms, and then we tested or evaluated the effectiveness of that intervention. With regards to our intervention, we did find that the self-help booklet intervention that we had designed for people living with HIV in Botswana was effective in treating depressive symptoms among people living with HIV. And this was a very important finding because we don't have a lot of interventions for our people. However, of course, going forward, it's important that we look at screening and referral into the program, and that implementation at large scale as well. So we need to be able to have this program reach people that need it, especially in rural areas and in other areas that are away from the cities. My hope is that because we have an intervention that works, that it can be rolled out at large scale and adapted to other populations besides HIV. So already we see that there's potential for adaptation to other conditions as well and other populations.